Welcome to your meeting, the European Society of Surgical Oncology here in Bordeaux. Very successful meeting. And here we have the top team. We've got the past president, Irving Taylor. We've got the president at present, Kok van der Velde from Leiden. And we've got the president-elect, Peter Naredi. Welcome, gentlemen. We're here to talk about ESSO, where it's come from, how things are going at this meeting, what the highlights are, and what your future plans are. I know that one of the big issues is quality, so we must have words from each of you about that. But first of all, the elder statesman, Irving, where this specialty has come from, and what the birth pangs were, and are we in good shape?
We're in very good shape, Gordon. In actual fact, the first meeting of ESSO took place in London in 1981, so this is the 29th year of ESSO, and during that time, as you can see, the whole concept of surgical oncology in general has expanded, and certainly our society has expanded to the extent that there now are some 880 registrants for this meeting, which is one of the biggest we've ever had. And we're very proud of that, and although surgical oncology is not in itself recognised as a specialty of surgery, nevertheless I think there is increasing recognition throughout the community, certainly throughout the cancer care community, that surgery is the prominent modality of treatment for all solid tumours. And one hopes that the recognition of the importance of quality surgery is paramount in getting good outcomes. Although, of course, we all now recognise the absolute importance of multidisciplinary approach to solid tumours. But within that multidisciplinary approach, the way in which a surgical procedure is carried out to ensure that the solid tumour is removed in its entirety with a good margin of clearance and the appropriate lymph nodes, I think there is a realisation now that this is paramount. And I'm really very proud to have been associated with ESSO because during this 29 years of its existence, there is no doubt that the quality of surgery throughout Europe has increased significantly.
And you know my view that that's related to the improvement in outcomes for patients.
Of that there is little doubt. The outcome measures, it depends, actually it doesn't really matter how you measure outcome, whether it's quality or quantity. Whichever measure you take, there has undoubtedly been an improvement. What we want to try and ensure basically are two things. Firstly, that there is a harmonisation of outcome throughout the European states, so that a patient in southern Portugal has as good a chance of being cured of his solid tumour as perhaps a chap in northern Finland. In other words, that there's a harmonisation, there's a recognition that the quality of cancer surgery will be equivalent throughout Europe. But there's also the recognition and the importance of this, of training. I'm not sure you want to talk very much about training, but surgical training is a hot potato. It always has been, and it certainly is now. And one of the key issues, and that's why ESSO is so involved in workshops and in symposium. And in fact, we had a very, very successful live surgical course on liver resection during this meeting for 52 trainees from throughout Europe coming along, taking part, watching live surgery from experts, and the training issue is absolutely crucial, and we must ensure that the quality of that remains.
Music to my ears. You know, of course, that ecancer has got video in it, and we're very keen to facilitate online training.
Yeah.
Kok, you must be very pleased with the turnout here.
Yes, the theme of the conference is surgical outcome, can we do better? And a lot of the sessions are around that theme. Quality assurance is one of the key issues in our society now. And we also, actually today, we will form Eureka, the European Cancer Registry, which is all about, at this moment, colorectal outcome measurements, giving feedback to individual surgeons, to hospitals, but also now country-wise, and see what the differences are and how we can improve things further. Part of that, of course, has to do with training, retrain, but also multidisciplinary management. So we reach out also to the other societies like ESSO and ESMO, and they are components of this Eureka project, which is one of the central issues, has been over the past years in ESSO. So ESSO will have a construction, and ECHO will also be involved in that, to ensure continuity and to provide a template not only for colorectal cancer patients and feedback, but also for breast, upper GI, and so on and so forth.
And you're the next president of ECHO.
I'm the next president of
So
ECHO.
you're in a very good position to make sure that you
Yeah.
follow through with this multidisciplinary approach, because it has to be a priority for ESMO too.
Yeah.
ESTRO I've seen in action, and that training program is terrific. 32 courses this year,
Absolutely.
all over Europe, and a few in Australia and in Japan and so on. And they've got the message, but I think that you will be in a very strong position to take the ESSO message through in ECHO.
Yeah, well, the same is true also for guideline development. That should be based on realistic outcomes and realistic possibilities in the different countries. So we will organize next year for colorectal cancer a guideline development conference together with the other societies, based also on the results of the different countries and the possibilities, and base guideline development upon that. Also in connection, for instance, with NICE guidelines. Graham Poston is in charge with colorectal cancer development guidelines. So we will have them all together and not per society alone, because the evidence is that they are not very often used in the different countries and among the members. And that's what we want to change as well.
You know the FP7 project, which I'm involved with, called EuroCancerComs, and we've been looking at where all these guidelines are, because we want to have a signposting website that gets people, professionals, but also patients. And when you talk to patients about guidelines, they are absolutely blank.
Yeah.
They say, well, we don't know where they are, we don't understand the technology, we can't check whether we're being treated according to a guideline or not. And then when we ask some of the guideline developers from ESMO and from Usoma and so on, how many patients did you consult when you were making your guidelines? The answer is uniformly zero. So I think that there has to be some sort of meeting also with the patient community, and I'm sure that you'll find that an interesting challenge in your next job.
Absolutely. Well, there is indeed a task to streamline this, but also nurses, of course, should be involved,
absolutely.
and they have not been in the past. So that should be a new structure in Europe. But ESSO has been so far in the lead to organize that, and will so through my presidency of the European Cancer Organization.
Peter,
yes?
you're on next, and you're the next president. Where are you moving? Clearly, quality stays with this society for a long time to come, because standards have got to get up, and nobody's going to do it if you don't do it. Other things on your agenda?
Yeah, but I think the quality assurance questions have more and more risen as our central question. It's from there we can actually discuss what guidelines should we do on a European basis, just like you said, but also our educational program. We have a course for medical students together with ECHO. We have these workshops like we had for colorectal liver mets now. But the question is, what are the most important educational activities we can have? And we think we are focusing right now, but I think through the quality assurance work, we will understand where there are really spots in the knowledge in surgical oncology
it's not a sexy topic for funding, is it? And this has got to be a challenge for you, because people would rather fund an oncogene than getting a bladder repair done properly.
Yeah, but the role of ESSO as one of the founding members of ECHO and supporting ECHO to be like the body for cancer in Europe, I think it's very important that we work with these questions, and I think we have larger visibility throughout the national cancer plans today, because these are the key issues. Why only put together national cancer plans from random thinking? It has to be evidence-based, and working with quality assurance questions, I think we get the platform for bringing these questions up. And at least in Sweden, I noticed that as surgeons, we are getting more and more impact on the national cancer plan. Sure. So I think this is the right way to work.
Peter, some countries don't have a national cancer plan. Most countries in the EU do not have a national cancer plan. We do not have a European cancer plan. And I think, quite honestly, if that's going to happen, I would be looking to the surgeons, as in the beginning of ECHO and FEX and the beginning of ESSO, the surgeons to take that on. The surgeons have always measured outcomes better. You know, it's just a fact. Yeah. And so I think the ball is still in your court, actually.
But indeed, bottom-up works way better than top-down. Yeah. Cancer plans come from the government, and everybody thinks, well,
public health people and so on.
And from bureaucrats. But these plans come from the surgical community themselves. Yeah. They look at what they did wrong and how they can improve. And that really improves outcome for patients in Europe.
This is where I want to go. ESSO should be in the middle, so we should work up towards our government, towards the Commission, to really implement how important it is with cancer care and that we are an important part of it. But on the other hand, we should go out to our members and to surgeons throughout Europe with the evidence we get from quality assurance work and say, this is where you have to focus, what do you have to focus on?
So I saw a nice edition of the journal, your journal, based on quality control and audit, and it really was extremely thorough. And I know that I saw your names involved in it. I'd really quite like to see in a couple of years' time a rerun of that journal with the medical oncologists and the radiation oncologists in there. And I really wouldn't mind seeing the nurses' views on it and the radiation technologists. And you know, asking the patients what they think about quality. You might think it's a foregone conclusion, but it's not.
Totally agree.
And I really think that that's the way forward. And I've not seen anything like this supplement, and I congratulate you on it.
2013 is the ECHO conference in Amsterdam, when I'm chairing them, so and that will be a central team for all the societies involved. The problem, as you mentioned, you have an FP7 grant. We did a major effort as ESSO to get one as well, and we were not successful.
Well, you're welcome to team up with the helicopter vision people like Ervig and I. And I really think you should be involved in these FP7 projects, actually. I really do.
But at the same time, you say these are not so sexy and we don't get the funds. Remember, this meeting really focusing on quality assurance outcome is attracting more surgeons than any other ESSO meeting. So I think among the profession, we are really realizing that these are important questions.
Yeah, good. Gentlemen, I know you're terribly busy at this meeting. You've got lots of sessions to go to. Thank you very, very much indeed.